Hello, everybody. Thanks for coming out. I want to thank everybody for coming out. I'm John Thompson, and tonight we're having a town hall about the conditions and give you some information on the conditions at our county prisons. And I'm just going to go off the assumption that people in here do not understand what the county prison is. The county prison is basically where they put you at when you can't make bail. In this city, we have about 4 institutions that they keep them in. So you're going to hear information tonight about the conditions, not just about the conditions, but also about what you can do to help, how you can relieve some of this suffering. You're going to hear from people like the ALC. You'll hear from HRC. You'll hear from Why Not Prosper. You'll hear from Power. You'll hear from Philadelphia Neighborhood Networks, the Charles Foundation, Sankofa. You'll hear from a number of different organizations about some of their experiences inside those institutions, and things that's going on now and things that went on in the past. One of the first people that you're going to hear from is Nia Holston. She's an attorney with the Abolitionist Law Center. She'll introduce herself when she comes on. But briefly, I just want everybody to know, I thank you for coming out. And I want everybody to understand that this town hall is to not only just to share this information, but to make the public understand how critical it is that we have eyes on those prisons. Because most people in those prisons are coming home. They're coming right back to our communities. And they're going to bring back all that trauma, all that anger, all that violence. They're bringing it right back to our communities. So I'm one of those people who say, treat people fairly. Let me tell you a little bit about myself right now. I'm John Thompson. I'm an organizer with the Abolitionist Law Center. I'm formerly incarcerated. I was incarcerated for 37 years. Out of those 37 years, I did approximately 14 years in solitary confinement. So I would consider myself an authority on incarceration, on the techniques that they use and the tortures that they do, the things that they do to people while you're on the inside. And I want everybody to understand tonight that when you hear from these people, you're going to hear firsthand accounts. We have people, some survivors that are going to be giving you some testimony, telling you about their experience and telling you about the things that go on and things that you can do. So I don't want to take up too much time because I want this program to run smooth. Occasionally I'll come back in and tell you a few little bit more tidbits. But for now, let me introduce Nia Holston, ALC's attorney. Nia.
Thanks, JT. Appreciate that intro. Good evening, everyone. As JT said, my name is Nia Holston. I'm a staff attorney with the Abolitionist Law Center. I'm also one of the co-counsel for the remit conditions litigation that began in the April of 2020, specifically focused on making sure that people who were being housed at the Philadelphia jails on State Road could get access to things like testing, masks, cleaning supplies and things like that to ensure COVID safety protocols and provisions. Over time, that litigation expanded quite drastically because of the specific conditions that were occurring at the Philadelphia jails. And that it was not just the COVID pandemic that exacerbated those conditions. And what that resulted in, because of severe understaffing of medical professionals at the jails as well. What that resulted in were just extreme conditions that even, I guess, outstripped other jurisdictions around this country who are also dealing with the COVID pandemic, right? And so when I say the extreme conditions, what I mean, and this is in our lawsuit that we filed, we ended up filing an amended complaint that dealt with, that expanded the lawsuit and dealt with some of the conditions issues that people were experiencing. It was extreme isolation and prolonged isolation We would go into the jails and meet virtually with incarcerated folks, our clients, as a part of this class action litigation, who informed us that they had not been out of their cells for days and sometimes even weeks, going without showers, going without family visits, going out without attorney visits, going without any sort of programming, going and having to deal with all of those conditions in an extreme manner during a terrible time across the world. And so as those conditions were happening, the class council saw the need to expand the litigation to wrap in those particular conditions, particularly also in light of the fact that the death rate at the jails is high, extremely high in comparison to other jails and prisons across the country. The jail homicide rate at the Philadelphia jails at one point was 40 times the national average for the data that was publicly available at that time. There were 5 homicide deaths in a 9-month period between August 2020 and May 2021. So these conditions are incredibly extreme. And so the litigation focused on the violations of the constitutional rights of those who were being housed under these conditions. There were also extreme court delays that were exacerbated by quarantine policies and procedures, as well as staffing issues at the jail. When I say staffing issues, I don't mean to say that lightly. I think it's important to talk about, we're talking in the hundreds of staffing levels of people who were no longer being were not being provided with particular protections. So the jails were understaffed by their own metrics in the hundreds, and that resulted in very, very dangerous conditions for folks who were housed there. And so I think it's incredibly important that we talk about that. And so in relation to extreme court delays due to quarantine procedures that were exacerbated by the COVID pandemic, in addition to staffing issues that also impacted extreme court delays, what it would result in would be that if a person missed their court date, they would then have to wait at sometimes several months for their court date to be rescheduled. And so the amount of time overall that people were spending at the Philadelphia jails increased dramatically due to these issues that we were seeing. And so I think it's just incredibly important to talk about that context and how important it was for people who were the attorneys in this class action litigation to be hearing directly from the clients who were experiencing it, because the clients are all of the people who had been incarcerated at the Philadelphia jails under these conditions. And we were hearing directly from them, and dozens of them provided statements detailing the conditions that they experienced, detailing issues with not getting help when you're having an emergency medical situation and you're pressing the emergency call button in your cell and you're not getting assistance. Issues related to violence around phones and tablets, issues related to the use of pepper spray at the jails, and how that was impacting folks. And so all of this is just critically important to talk about the ways in which COVID exacerbated it, but COVID was not the only thing that affected the conditions at the jail. And that specifically it's the policies and practices and procedures that were in place that were really impacting the conditions at the Philadelphia jails. And so I think that is just critically important to talk about specifically, and to put a number on it. In 2021, 18 people died at the Philadelphia jails. That's just an incredibly high number, and is quite frankly unacceptable. Any number would be unacceptable, right? And so I think it's important to have that context. And so in the context of this litigation, where we're filing status reports and having conversations with the court, in addition to that, through the as we ended up getting a settlement agreement for specific policy changes that were supposed to be implemented at the jail that dealt with all of the issues that I've talked about in the litigation. I don't know if JT's telling me that my time is up.
Yeah, so 30 seconds. No,
30 seconds. Okay, so I'll speed it up. I'll provide a link to the settlement agreement that is available online. What the settlement agreement includes, it specifically is for an independent monitor to be appointed for a period of 2 years that can be extended. And that monitor will oversee the settlement agreement and specific aspects of that settlement agreement. If you have a loved one that is incarcerated, if you are an advocate that it works with folks, please contact me. Please provide that information so that we can make sure that we're informing the monitor of these issues as well. So with that, I'll turn it over to JT.
Thank you, Nia. So as you can see, the conditions in there sparked litigation, and the deaths, the 18 deaths, that was just something that to think about. That high rate of death in a county prison. So let's move on. We're gonna move on to Barth, Mr. Barth, Noah Barth from Prison Society, Pennsylvania Prison Society. Noah.
Hi, everybody. Thanks for having me, John. My name is Noah. I work with the Pennsylvania Prison Society. As some people, I recognize the number of faces on this call, so some of you are aware, we are actually written into state law as having a legal right of access to meet with and inspect the living quarters of any person incarcerated in the state of Pennsylvania in a county or state facility. And so we have a group of about 300 trained volunteer monitors spread out across Pennsylvania that are doing this every day, responding to calls and letters, meeting with individuals and helping them resolve issues. We get somewhere on the order of around 180 to 200 calls and letters every week from people inside of prisons and their loved ones raising concerns. And in April of 2021, the number of calls we were receiving about Philadelphia specifically doubled in 1 month. And so that really raised the alarm bell for us. And I'll sort of press fast forward on story time and say that since then, we've been going every 2 months to one of the 5 facilities on State Road and spending the day walking through the entire facility, observing with our own eyes conditions, but also interviewing folks, having structured, anonymous, voluntary interviews with anyone incarcerated who wants to speak with us. We make a point to always go to segregated housing when we're there so that they have an opportunity to share their experience as well. But we've been throughout. I see a few people on this call who have joined me on those. Miss Yvonne, Miss Andrea from our Philadelphia chapter. I see Sarah Jacobson, formerly from the Jail Oversight Board, who attended with several of her colleagues last year. Tomorrow I will be at PIC for the day with 2 senior staffers from City Council as well. I'll drop a link in the chat when I'm done yapping, but part of this is we write official memos that first go to the commissioner for comment, and then to all of, actually that's not true, it immediately goes to all of city government as well as the Philadelphia legislature to shine a bright light on what's going on in there. A lot of what Nia has already shared is the same things that we've experienced with our own eyes and heard with our own ears from the people inside. It's detailed in specifics in this report. A couple things are starting to get better since the Remick decision, but by and large, things are just as bad, if not perhaps worse in some cases. Just to put a fine point on it, things like people with the same sheets and the same clothes for 6 months at a time, shortages of toilet paper and feminine hygiene products, verbally and physically abusive staff, lots of broken phones that aren't working, as Nia said, that can often spark fights and disagreements between people in custody. Rusted, moldy, disgusting showers. I've seen this with my eyes, medical emergencies going unattended. People and this is the key part actually that I should have led with, people are routinely locked down for 23 and more hours a day in their cell, sometimes multiple days on end. We heard from people in multiple different facilities that over Mother's Day weekend, they were locked in for 5 straight days. So that's 100 hours in a cell with another person. And the prison does not provide anything productive to keep yourself occupied with. No access to the library, almost no access to the law library, no books, games, anything like that, right? So it's pretty awful conditions. As Nia and others have pointed out, there's a lot of violence, which is unfortunate, both between people locked up and from the staff. We've also received plenty of reports of staff standing by while fights are happening, or even encouraging or laughing at, et cetera, when people are fighting one another. So there's also a level of, well, I'll call it what it is, depravity, right? I think Nia hit the nail on the head that understaffing and COVID have made everything more difficult and made everything harder on everyone. But at the same time, there's more that can be done with the resources they have. And that should not be used to turn an eye away from, you know, what can be done right now. Well, how can the staff make it a better, I don't want to say better, but at least safer environment for everyone in custody. There's also been a lot of problems around COVID specifically. I remember going into the, and John, just wave at me when I'm going too long. The intake area.
Everybody get the hand up in 1 minute. At 1 minute, you got 1 minute.
1 minute. So this is the last anecdote I'll say then, which is, you know, you had 10, this is at the height of COVID, before vaccines, before everybody had access to vaccines. And you had, I think it was about 12 guys in a single holding cell who had just came to the jail. They told us they'd been there for 3 days. Every other holding cell was empty, and they're packing these guys into one room, okay? There's been other issues like that across the units with things, you know, COVID not being managed in what I would consider the safest, smartest manner. So people are in trouble inside. Also, okay, this is the real last thing I'll say, is family visitation is also, it was cut off completely at the start of the pandemic, and has still not come back in a meaningful way where people can stay connected to their families, either by phone, video, or in person, and it's a major problem. Thank you. Oh, and I'm going to drop a link for all the reports. Please take a look.
Thank you. Please do. You can get that chat. Anything you want to put in the chat, put it in the chat. People can get it out. This is being recorded, so everything will be captured. Everything will be captured in the chat. So whatever you put in the chat will be captured. Next person that we're scheduled to have on is Movita. Johnson Harrell.
Good evening, everyone. Movita Johnson Harrell. And I put some stuff in the chat. I am speaking on the conditions that were going on while in COVID. And the blessing for me is that I journal, and I journaled the entire time I was in prison. So I was able to go back through my journals and realize that on March 3rd, Monday, March 3rd, of 2020, the jail went into restrictive movement, meaning that women were only able to be allowed out 10 minutes of the time for the entire day. Programming then shut down, and it was really bad. So I actually was 2 cells away from the first woman death on State Road. That was Yvonne Harris. She was on G unit with me. I actually worked in the kitchen, and we were in the kitchen for 12 to 13 hours a day, because when it shut down, in fact, let me read something. April 3rd, 2020, at 11 a.m., RCF went into full lockdown. 15 minutes time for shower and phones. Only inmates were allowed out are essential workers. Now, mind you that even some women were not being let out for the 15 minutes because the COs were letting their favorites out. And I was actually the block rep, like literally the women elected me to be block rep against my permission. And I went from cell to cell to cell, getting signatures and fighting with the COs to make sure that every woman on G unit was able to get out, to get her showers, and to telephone her family. Another thing that happened was on 3/16, the outside world shut down. Women didn't have access to their attorneys. They didn't have access to their judges. Some of them were scheduled to be released, and nobody was being released at that time. And because of my relationship with District Attorney Krasner and Kara Gray, I was able to call my husband. My husband would have Kara and Larry on another line, and we were able to get women some of the answers to their questions. We were able to get petitions written for them to be able to be released from jail. But I'm going to finish reading this. There were only 3 of us. They're allowing into the kitchen food service staff. The white shirts came to the kitchen today, and I told them that none of the essential workers had masks, and that we had been in there for 2 days without them. Could we get them? And the white shirt does to get them from the food service workers. I told them that they didn't have any more. He said he didn't have any for us. We were in the kitchen from 5 a.m. to 4 p.m. without with 1 hour break, making sure that all of the inmates in the entire RCF were able to eat. Inmates began to make their own masks out of bed sheets, out of towels, out of tablecloths, and because the prison was not providing them. And my O's, when the COs were coming from the outside into the prison, they were not masking up. Listen, the essential workers in the doctor's office were not washing their hands. They were not masking. They were caring for the inmates. Now, for me, I got my first symptom of COVID on April 1st. I told them I had COVID symptoms. I had every symptom but the fever. They had kept taking my temperature. And I told them I don't have the fever. I have everything else. I lost my sense of smell, my sense of taste. I had the body aches. I had the cough. They continued to send me into the kitchen to make the food for the other inmates. They did not make sure that I had masks. I had a really good relationship with some of the COs and with the kitchen staff, and they made sure that I had masks. And whatever I could get, I was sharing with the other inmates. But the thing is that they wanted to blame the inmates for COVID coming into the prisons, and it was the COs bringing it in, and the COs not making sure that they were taking the precautions, that they were not washing their hands, they were not masking up, and they are the ones who actually brought it in, and it ran rampant in the prison. And listen, women were being locked down for 23 hours and 45 minutes every day. Everybody began to get stark crazy. Like, women were literally throwing things against the cell doors because it's inhumane for someone to be locked down that amount of time. So I'm grateful for John for letting me share my experience. I was in there. I actually came home on April 6th of 2020, and I came home with full-blown COVID. And all I could do was crawl into my bed. And literally, I did not get out of my bed until April 20th. And it was really bad. And the only reason why I didn't go to the hospital, I couldn't breathe. I couldn't move. And the only reason why I did not go into the hospital was because people were dying in the hospital. And I was not going to the hospital. If I was going to die, I was going to die in my own bed with my family around me. So a lot of women caught COVID while we were in there, and then they were subjected to inhumane conditions during that time. Thank you.
Thank you, Movita. Thank you for that direct testimony, the direct information from people who were actually there when this happened. That's one of the reasons why we need to have oversight. We need eyes inside of those institutions. We need to have people like concerned citizens that are here tonight who can walk into those institutions and look around, talk to people, and actually get something done. We need to have oversight because you can't allow that kind of treatment. I know that when people come on here and talk and speak about their experience, I know it's true. I've been through it. I know how callous the guards can be. But it's up to us as citizens to ensure that everybody enjoy their human rights. Not just me, not just him, not just my brother, my sister, everybody to enjoy human rights. And that extends to people who got locked up. Because I was there one time, so I understand how it feels. And I always would want someone in the public to stand up for me and say, to look into that, to see what's going on, to make sure that I'm not being harmed or abused. So one of the things that we're going to ask tonight, we're also going to ask that people sign up for organizations, that people sign up for one of the organizations that are represented here tonight. Before we leave, we're going to have every organization just say their organization, and you can say whether or not, you can put it in the chat if you want to join their organization. Because that's one of the goals, to increase the numbers of people who will be available to look into these institutions. So our next speaker is Chris Jimenez, Reverend Jimenez. Chris, you can introduce yourself further, sir.
Okay, good evening, everybody. I'm Reverend Chris Jimenez. I'm the Associate Pastor for Social Justice at the People's Baptist Church. Also am a member of Power, and I serve as executive director of Healing Communities PA. We are a faith-based justice transformation organization. JT asked me tonight to really speak on and speak for those who have died at PDP and, throughout the pandemic. So we know that there are 29 individuals who throughout the pandemic up until now have died, many of them not actually of COVID, but of violence, of so many different things what really is scary about that number is higher than even the number of deaths in 2015, when the population at PDP was more than double what it is now. So we're looking at a death rate at the prison that is incredibly more than when the prison was actually at over 11,000. And it's less than 4 now. So this is getting to be, some of the deadliest last couple of years that PDP has ever experienced. And there's not a lot of explanation for it. There doesn't seem to be a lot of investigations into what is going on. There has not seemed to be, there doesn't seem to be much of the community, even though the information is out there. The Philadelphia Inquirer has written probably in the last 18 months, I know 16 or 17 articles that I've read personally about conditions that are going on in the county prisons. And there has been very little outcry from the community, and doesn't seem to be a lot of response from the city. The mayor's office has been silent. The commissioner's office has been silent. And up until the last press from council during the budget hearings in June, there had not been a lot of questions publicly even from city council on what was going on. And some of the deaths are really horrible. And I know, and to talk about the lack of staffing. In fact, there was one that's really stuck out for me. A gentleman that somehow the pipes, the fire extinguisher pipes in his cell broke open. And his cell began to flood. And even though he was pressing the emergency button, even though people on the tier were yelling for the guards, he was evidently left in a flooding cell for 6 to 8 hours before help finally arrived. And he was already dead. And we're not sure, depending on the flooding, whether he drowned or he died of exposure from that cold water being in his cell, flooding his cell for hours. The medical examiner's office never released the exact cause of death, but he either drowned or he died of exposure. No one should have been left in those conditions that many hours before staff came, to do something about that. And that's been indicative of the conditions that have gone on there for quite a while, and they still have not been. We're still not seeing programming opening back up. We're still not seeing visits opening back up. We're still not seeing people getting regular out of cell time. This is a real crisis. And when we think about those who have done, who've dealt with this, what really concerns me is the lack of anybody seeming to care in city government who are responsible for this, or the commissioner's office, which has kind of just been telling us we're all lying about this. So we're all, it's not true, or it's taken out of context, or it's not as bad as we're experiencing. But to be left in cold water for 6 to 8 hours, to die like that. And this gentleman should have already been released. His case was over, and he was only being held on scofflaw, which means he was only being held to handle some stuff with traffic court. So you died in a cell, either drowned or died of exposure, when the only thing you owed the city was some traffic tickets. That's just not humane. And that's why, and that, entire lack of responsibility on the staff is why we're pushing for oversight. So I had placed a link in the chat. I'll place it again to the petition that Councilwoman Helen Gill's office has put in, the legislation that she's put in for a prison oversight commission. And while that is something that we're advocating for, and one of the solutions that has been put forth. So we'll be I'm gonna put the link back in the chat again so that you can find it, sign the commission, sign up, find out more, petition, and find out more about the proposed prison oversight commission. Thank you.
Thank you, Chris. And one of the things about the prison and being in prison is that you're supposed to make rounds. It's supposed to be, I mean, if it's just one guard, he can literally walk around that whole institution all day for the 8 hours. If it's just one guard. So it's unconscionable that somebody would be in their cell under those conditions unless you're just callous and just not paying that person any attention. And then it resulted in a person's death. So these are more and more you understand why you have to have oversight, why you need to have regular citizens looking into those prisons. Things like that should never happen. We're gonna move on. We're gonna hear from the Reverend Michelle Simmons from Why Not Prosper. She can properly introduce herself when she comes on.
Hi, everybody. Good evening, my colleagues.
Hello.
Yup, can you hear me?
Yes, we hear you clear.
All right, so good evening, everybody. I'm Rev from Why Not Prosper. I'm the founder of the organization, and some people may or may not know it's a transitional house for women coming from prison. And what my task is tonight is really to talk about the history. And I just want to put out here that like the women have been maltreated always since 1938, okay? They were thrown into Eastern State with men and their children and tuberculosis, and it was all just piled in there. And some advocate back in 1938 recognized this dilemma, and that's how Muncie was birthed, okay? And so this is like not new situation. I can even recall back the conditions of, the prisons and the complaints of the women back in 2006. Why Not Prosper was 21 years old, and since I had 3 years open, I've been in the jails. Since Why Not Prosper been 3 years old, I've been in the jails, and so much so that a women's working group was formed back in 2006 with Prison Society under Ann Schwartzman. So we've been tackling these issues for a long while. What I like to do real quick is, only got 5 minutes, but I got a couple stats from the Vera Institute. And I just want to say that, our women in the Pennsylvania prison system, we're number 2 far as jail admissions. Far as prison pretrial population, Pennsylvania is number 1. Okay, far as jail sentence population under the Vera Institute, Pennsylvania is number 2, and under these women, it just become what it is now. I read you the stats. So we're either 1 or 2. Pennsylvania is out of the whole state. And then also what I think is real important to note right now as it relates to history is that forever our prisons is the dumping pot for our mental health, okay? And so just put that on top of all the conditions in the jail. 68% of them have mental health because we only have 302 psychiatric beds in Pennsylvania. So when they don't know what else to do with a person with mental health, they end up in jail. Okay. And during COVID, I'm also a CAC member. And so during COVID, some of the work we did was we wrote recommendations to the prison, asking them to release their policies, like how are they dealing with it. We met with, the commissioner, so-and-so a couple times. And of course, they was assuring us that they was doing things. But we got very little responses as a CAC to our recommendations. Okay. Also during COVID, you know, I got firsthand of, I kept the doors open during COVID. You know, when the government made that announcement to release people, you know, we kept the doors open. So of course I was getting the women, and, you know, we had a room all designed for those that may have been affected or coming out of quarantine. So they was just telling of the horrible conditions, the no mask, and so forth and so on. So I have that experience. And then one last thing, I probably could go on and on, but I don't want to see the hand. It just went up, okay? But also we took care packages up there during COVID to give the ladies something to do. And then the people that the CEOs that collected the stuff did not have masks on either. So I had to say, where y'all masks at? So I just want to say the history of the women's, this has been going on. They just moved the women to PIC. You know, they moved them from RCF to these trailers, which we probably all know about. And now they're over at PIC, and the move was supposed to happen so they could have more space. But my time is up. And I just want to say that, you know, I'm happy to be a part of the coalition so we could dig down in a little bit deeper. I walked through PIC the other day, and rightfully so, you know, we still have holes up in the ceilings, and you know, all the laundry room was a mess because I had to go in there and get the car out so I could put all the love bags in it. So I could just attest to some of the things that's going on. And I'm also in the same hand trying to address them as I can by like the love bags and registering them to vote, even in the midst of all this chaos.
Yeah. Thank you, Reverend Michelle. As you can see, the women, and I always say this. Sometimes we forget that there are women in those institutions, and their care is probably even more critical than men when they're in there, because they're vulnerable. They're more vulnerable than men are when they're in those institutions. And I, for one, sometimes neglect to reach out to my sisters that's in there, but it's not intentional. We have sisters like Reverend Michelle here that does it. She even collects stuff, hygiene products for the women in there, because let's be real. A lot of times women go in there and they don't have money and stuff like that to get out, and they stuck in there. They don't have their personal hygiene stuff. And for a woman, that's number one. You know, that's, you know, so anybody who can provide any of that care stuff for Reverend Michelle, please drop your name in there, because she's always looking for those donations for those hygiene products for the women that are incarcerated. Okay, next we're going to hear from Tim. Tim is from PNN, Philadelphia Neighborhood Networks. Tim?
Yeah, hi, John. So you've Tim Brown, Philly Neighborhood Networks. You guys heard what NOAD said about the Prison Society's report. John asked me for my thoughts on Carney's response to that report. So here goes. Having read this 4-page response to the Prison Society's report, I'm struck by two things. First, that the commissioner's response oozes with the facade of cooperation. And secondly, that in every instance, she either punts the issue back to the Prison Society or avoids it altogether. Let's take a look at those issues as the commissioner replied to them. First, to the issue of being locked in cells for extended periods of time without supervision. Her response is first to claim the necessity of segregating certain individuals due to security concerns, and the claim that they're permitted less time than the average inmate without specifying why they have that time restriction or what that restriction actually looks like. Then she used staff ratios as her excuse for not complying with out of cell time, while offering the vague promise of compliance with, we strive to ensure segregated inmates receive daily out of cell time. Again, without the clear promise to follow the guidelines under Pennsylvania code. And she doesn't address the specific contentions of inmates that they've been left in cells for days at a time, as Noah pointed out. As for the other inmates, Carney claims that prison records show that they are substantially in compliance with requirements imposed by the federal court for out of cell time following the Remick decision, without, again, quantifying what she means by substantial. Are all the inmates getting 2 hours, an hour and a half? We just don't know. She doesn't respond to any of this. Now, regarding the buzzer system that was mentioned, and the Prison Society report made it clear that the guards, while they were there, attempted to use the buzzers in 2 cells, and neither of them worked. Now, the commissioner's response was, please be assured that we are conducting a review of the operation of our in-cell buzzers, which, considering that the only 2 buzzers they tried didn't work, doesn't give me a feel of assurance. That it's taking so long for them to do this amazes me. This is an institution, a bureaucracy, and you would think that they would be able to check phones to see whether or not they work within a day or 2. And still this hasn't been done. She adds to this to claim that we have always stressed continual touring and observation by our housing unit officers, which is in direct contravention of the facts laid out by the Prison Society and mentioned here this evening, including the man who laid for hours bleeding without anybody responding. So much for this continual touring. Now, regarding complaints of violence that stem from being locked up in a cell all day, and the commissioner says, well, unfortunately, fights do happen in a prison setting. And she asks for specific incidents of where guards use unnecessary force on prisoners. Look, if the prison is keeping any sorts of incident records, I think it should be pretty easy to track down the guard who pepper sprayed the naked inmate in the shower. Again, this is something that a facility should be monitoring, and that they don't have records for this or will not show the records for this is telling. Regarding family time, the Philadelphia Department of Prisons has yet to reopen family visits. It also reported that access to phones and tablets for video visits were severely limited due to broken equipment, restricted hours outside of the cells, and the apparent mood of the guards on that day. Now, you would think that something as organized as a correctional facility could figure out a schedule for the inmates and adhere to it, but that's not the case. And the mail is delayed too because it's not getting picked up every day. Now, the commissioner's response is first to claim that 350,000 video visits have taken place since 2020, which sounds like a lot, but it's really a statistic in search of context. If the tablets weren't broken, if the inmates had sufficient access, how many more visits would have been able to take place? We just don't know. She also makes the counterclaim that we have sufficient tablets to ensure that all inmates are able to use them. Again, without quantifying this in any sort of way in response to the Prison Society's direct complaint that there aren't enough tablets nor times for the inmates to have access. So regarding the in-person visits, the commissioner reversed the usual path about following a strategic phased-in approach, again, without providing any specifics about when this approach to visitation will actually happen. And regarding medical care, the inmates reported long delays in getting care, as well as a lack of privacy in discussing their medical issues. The commissioner's response is to claim that their sick call slip is effective in handling medical issues without specifically addressing the issues raised by the Prison Society. Again, it's another non-answer. In summary, the response from Commissioner Carney seems reasonable on the surface, but it's essentially unresponsive. It kicks the can down the road instead of being proactive in solving the problems in the facilities under her watch. Now, nobody's saying that running a correctional facility is easy to do, but it's clear that this commissioner is negligent in her duties and is not in compliance with current federal and state laws. So it's my belief that she should be held accountable for the negligence and should demonstrate an honest commitment for transparent solutions to problems clearly stated by the Prison Society. Let's hope that this settlement agreement that Nia spoke about will help to address some of this. John? John, you're on mute.
Somebody muted me. That was Carney's response. Carney is the commissioner of the PDP, and no answers, nothing tangible came out of her answers. It was just, tell me who these people are so I can send my guards in there to torture them, to make their life miserable, right? People who have been to prison know what that means. Tell us who that was that said that, so we can go make their life miserable, right? And nobody's going to do that. Nobody's going to do that because you put people's lives in danger when you do that. The commissioner has no idea about the things that need to be done to make prisoners safe. Why? Because she doesn't care. She just doesn't care. It's like they're animals or something. Like, she doesn't care. She gets her paycheck. She does what she does. And you see her from her response that she just really don't care. Everything was, tell us who it was. You know. But that's the way that prisons work. That's the way prisons operate. If anybody have any questions about anything that was said tonight, put it in the chat. We're going to have at the end, we're going to have some time for some questions and some answers. The next person that we're going to hear from is Tanika Hogan. Tanika, you want to introduce yourself, Tanika?
Hello, everyone. Good evening. Thanks for attending. My name is Tanika Hogan, and I'm the community care coordinator for Sankofa Healing Studio and a representative of the Still We Rise Freedom Coalition. So everything everyone said tonight was like still on point. Nothing has changed. For the last 18 months, I've been going in with the two organizations to every Wednesday to speak directly with the women on the block as a vaccine champion / community care coordinator. The conditions are trifling is all I could say. Nothing has changed since I've been there, dating back to 1900s. The women are in there struggling. It's really bad. No, they've resorted to giving me and my colleagues direct grievances and sick calls because they're not getting answered to in the prison. So we forward those the information directly to prison officials, and some of the things are being tackled faster than others, once we do it. However, none of the women have had change of clothes since they've got into pick. Mice are running rampant over my feet as I go cell to cell to speak with the women about different things. There's absolutely no programming aside from Sankofa Healing Studio, the art therapy, and chill out. Other than that, is constantly in the cell all day, all night. Wednesday is the only day that they really have to look forward to. Nothing has changed with the tablets. Women are unable to get verification of outside vaccinations so that they can have visits. Nobody's seeing their children. Being as though they're 23 and 1, they're barely getting out for showers. COs, inmates are running the blocks, able to tell the COs who can get out, who can and who can't. White shirts are not doing any tours from the whole from 9 o'clock until 4 o'clock. When I leave there, white shirts are always huddled in a group, never on the blocks, never doing any tours. Everyone on at least on Wednesdays from the time that from 9 to 4. And I'm directly on the blocks and in the recreational area. During the time that we've been visiting the women for the last 18 months, women and men, we've been able to get do sanitary bags, giving all the women direct each woman, hundreds of women, each a bag with sanitary napkins, deodorant, pads, tampons, soap, lotion, anything that we could. We went to every single jail and was able to give each individual directly. I handed them out, got a signed signature from everyone to make sure that everyone had them. Those that had to be left because people were in court did not receive it because the COs were giving them to whoever they wanted to give them to. Sankofa Healing Studio, we also went in and did art bags multiple times to every jail, DC, Mod 3, ASD, still pick as we speak. Nothing has changed. It's really gotten worse. Women are not able to get in touch with a social worker. I myself will take notes, phone numbers. I will call mothers. I call parents. I connect with children. I could get somebody some food today. My mom ain't here. She ain't got no food. Whatever the issues that they may be struggling with inside while I'm there, me and my colleagues, we do whatever we can to support the women by doing things after work, whatever we can do, because, we were there before and we know, what it's been like. Again, the conditions are trifling. Nothing has changed since about anything that anybody has said. If anything has gotten worse. Mental health, oh my God, that is the worst. The women were like screaming, banging on the door, today, seriously, and one of the women was like, are you real? Is you a real person? Can you spin around, wave your hand, like, oh God, thank you for coming just to check on me, just to knock on my door. No medicine whatsoever. Individuals with terminal illnesses aren't receiving meds or just getting worse. It is downright horrible and disgusting is all I can say. Nothing is happening for them. And PDP is not being accountable for any of the things that, they're being called on, regardless of what organization, what lawsuit that they're on. We didn't even know that the women were moving. We had a previous meeting with them a few days before the move. They said, oh, nothing's happening. We have no intention of moving. Not right now. It's in the works, but that's maybe another 8 to 9, maybe 12 months. And then a week later, boom, they was gone. Just uprooted. There are supplies that were given to them from the organizations that we go in with, Sankofa Healing Studio, Still We Rise, anything that was given to them was confiscated. They're not replacing it. It's just a problem. They're struggling and suffering bad. And I'm grateful that we all are here sharing the same common interest, for this call for change. And just stay up, and thank you for letting me share.
Thank you. So you hear that conditions have not changed. You're hearing it from a person who goes in every week, goes into the prisons every week. Conditions are not changing. They're getting worse, right? They're getting worse because the prison's getting even more run down. There's more access points for the rats and stuff like that. The thing is, the next person that comes on, I really want her to go into the budget part that she was talking about. Janaea is here. Janaea.
Hello.
Hello, Janaea.
I got you, John.
All right.
Hello, everyone.
Introduce yourself. Thank you.
Thank you for having me. So my name is Janaea Pulliam. I am a private contracted advisor. I represent the ACLU, Community Legal Services, Reform Alliance, and all incarcerated women in Pennsylvania. Unfortunately, in January of 2020, I found myself detained on a technical violation because I rescheduled a mental health evaluation due to the death of the family member that I was providing care for, and it led to me being detained and so forth. So as my queen mentioned, Movita, she and I were actually incarcerated at RCF during the same time. I actually was one of 3 women that helped move the entire 150 to 200 population from RCF to ASDMI 3, and it was only 3 of us that did that. So I just want to touch some bullet points because you guys have heard the gist of it. So first and foremost, I'm gonna play devil's advocate, bear with me. Commissioner Carney is not favored by her security personnel. I have witnessed them go against a direct order after she's given it. Also, Corizon Health Services is the healthcare provider for State Road. They are the ones who have been habitually negligent prior to COVID and to this day. At points during COVID, we could not watch television because they said it would incite a riot. I have personally heard guards state that they prefer inmates locked in. It makes their shifts easier. I also want to say that there's been sabotage by fellow officers in white shirts. Once Commissioner Carney, Terrence Clark gave a direct order, they would completely disobey it. One Sergeant Bynum would even tear off Islamic women's hijabs and take their prayer rug as a form of torment. Movita mentioned Yvonne Harris, who was housed in between she and I. She actually caught COVID-19 from cleaning the offices of third floor administration over at CFCF, which is where the executive officers and payroll is held. So she caught COVID from taking care of the executives. Delayed court hearings, definitely. PDP failed to keep contact with the courts. Like myself, my court date was delayed an additional 30 days because he wasn't a public defender. He was court appointed private attorney. So he had to reschedule me because the prisons only shipped inmates out on specific days. Commissary was often stolen from one guard, gifted to another inmate, whether it's because the inmate was inside peddling drugs for them or because they favored and had a sexual attraction to the inmate. We watched this go on often. When things came in from, Catholic Social Services, Catholic Charities, Sankofa Healing, Why Not Prosper, they would be approved gifts, and then you would find the right officer who just felt like being evil and would just take them without any just cause. Further creating a spectacle and propaganda of torment. I made daily reports to Prison Society. I was on that phone like regular. I don't care, you can call me a snitch, you call me what I want. It's not snitching if I'm being oppressed and I'm demanding justice. I was on that phone all the time, like, this is what's going on. Whether it had anything to do with me directly or if I witnessed it at the unit on the other side, I was telling. Many of the staff left around July, August due to a payroll issue. Many of the officers stated after putting in an abundance of overtime due to short staffing, they had like $10 paychecks. This led to a lot of the correctional officers leaving the PDP and going to SEPTA, no less. When we ran out of toilet paper, we were told to utilize our washcloths. And we only get one, maybe two, if you're lucky enough to get it on commissary. But yeah, we were told to use our face cloths or body cloths to clean ourselves when we were literally out of toilet paper. And it was points in time where they was going around with rolls of toilet paper and rolling it off and giving it to, each woman individually. God forbid you have Crohn's disease or something like that where you need to go more frequently. Oh, DC, the women are at DC because Ellen and I condemned them. I personally went there, cleaned them, paint them, or whatever, tried to do whatever to make them better. I experienced exactly what Tanika described, and I caught an upper respiratory infection. And finally, the security guards are sabotaging their own Commissioner Carney because she's from social work and not security. Thank you for having me.
Thank you. As you can see, nothing has changed. It's still the same. And this is why we need to have, I'm gonna say it again, oversight. We need to have people that can go in there, that have some authority, that can do something, that can make something happen. You heard them, you heard also say that they go directly against the commissioner's orders. Who can go against, if your boss tell you to do something, who can say, I don't want to do that, I'm not doing that, and still have a job? Apparently, correctional officers, right? Because you can't do that anywhere else that I know of, right? And it's always done in a malicious manner on something that is being told about a prisoner. If it's a prisoner, I'm just not doing it. Use your washcloth for you know what? We're gonna move right along to a good brother Shabaka. We're gonna move on to brother Shakabuna Marshall. He is from the Human Rights Coalition. Shakabuna.
Yeah, good evening, everyone. My name is Shakabuna, Executive Director of the Human Rights Coalition. And I'd like to say that all the speakers here are correct. Nothing has changed over decades. And in fact, it has gotten worse. But the problem we have to deal with is a problem of looking at it from a perspective of human rights. Before the assassination of Reverend Dr. Martin Luther King Jr. and Malcolm X, they both had said that human rights is the issue of today and no longer civil rights. So looking at it from an international human rights perspective, and as well as laws and treaties that America has to abide by when it pertains to prisoners or incarcerated people, we have to try to hold them to that standard. And that standard really is a little more equivalent to the United States Constitution and the Pennsylvania Constitution about treating incarcerated people humanely and fairly, and not subjecting them to cruel and unusual punishments and treatment. And so with that, all is what has been said. We have to go about it with a lot of prison oversight and try to get prisoners empowered instead of being disenfranchised. So the Human Rights Coalition, along with Abolitionist Law Center and other coalition partners, what we have been doing is we have been trying to install a prison oversight committee that we can have in place that oversee the county prison system, as well as the Pennsylvania state prison system. So we're talking about an oversight committee that can look over these things and see where prison officials are being criminally negligent, where we can actually remove them from positions of power and get somebody in there that's going to treat incarcerated people humanely and fairly. Not only that, we have been doing, the Human Rights Coalition and other partners in our coalition, we have been trying to implement the Incarcerated Citizens Voting Initiative, whereas we're going inside these prisons and we're going to educate them on civics. We're going to give them voter registration. We're going to give them absentee ballots because they are allowed to vote. And if prisoners are empowered to have access to and the means to vote, they will vote. And now they get power, and so they can start removing different politicians and stuff like that. They can start influencing elections that will help change their conditions of confinement and their treatment within these prisons. And these prisons are such hellholes that we need that type of power. And that power got to come through prison oversight. It has to come through empowering incarcerated people to vote, as well as establishing a media apparatus that will always be able to shine the spotlight on the prison industrial complex. So when these people are doing a lot of wrong, a lot of criminal activity and stuff like that, we need to be able to highlight it, because we know that that's what gets the attention. And when the issue has attention, people tend to move. And so I would ask everybody who is trying to help out, join with us to help push for this prison oversight committee over the county prisons and over the state Department of Corrections. And let us also help to re-enfranchise or enfranchise the incarcerated people here in the county prison system. That way we can get power and we can help rectify the issue and hopefully abolish these systems of oppression. Thank you.
Thank you, Shaka Boone. Thank you, Shaka Boone. We're running short on time, so we're gonna move on to Sarah. I just want to get this once again and let everybody know to sign up for one of these organizations, become a part, be part of the movement. If you have any questions, please put them in the chat. We'll have time after the chat. We're going to hear from Sarah now. Sarah, you can introduce yourself. Thank you. Thank you for coming, Sarah.
Yeah. Thanks for inviting me, and thanks everybody for showing up for this. This is important. My name's Sarah Jacobson. I go by she, her pronouns. I'm here as a former member of the Prison Advisory Board. I'm here to talk to you about the current Prison Advisory Board and why it doesn't work well. It doesn't really work at all. And to urge folks to support change in the prison oversight structure. The current Prison Advisory Board, I was appointed to it and sometime around 2016 by Mayor Kenny. I resigned in May of 2022 after months and months and months and months of urging action, urging that we meet with folks like the folks who are here and the groups who are here, and just getting nothing back. The current Prison Advisory Board has no mission, has no authority to take any action. The leadership in the current Prison Advisory Board is completely beholden to the prison administration and not particularly responsive when other folks on the board ask to take action. During the time of COVID, well, I'll say this, the current Prison Advisory Board meets with the commissioner quarterly, really kind of talks to the commissioner and her administrative staff, and that's kind of it. Like I said, I think we've gone on one tour with the Prison Society of the Prisons. That's because I asked for it, but doesn't and won't meet with community groups, doesn't and won't give advice, and has no authority, right? So we had no mission with no authority either. It was made very clear to us repeatedly that if we gave advice, they didn't have to do anything with it. It was all just advisory. And during COVID and during all the awfulness that you've heard from folks, what we were told by the administration is everything's fine. Everybody has all the supplies they need. The women have all the supplies, all the hygiene supplies are there. All the vaccines that are needed are there. The health system is fine. Anyone who says otherwise is like blowing things out of proportion or making things up. And without the advisory board seeking broader perspectives, that's really all we heard. And essentially I reached a point where I just couldn't be a part of it anymore. So I'm really excited that Councilmember Gim has offered this charter change. I hope folks will vote for it. I hope people will be invested in it. For a prison advisory board to have any meaning, to be anything other than like window dressing, it needs to have a mission. It needs to have authority. It needs to have the ability to meet with folks without the commissioner there. It needs to have some staff to help it along the way. And it needs to have people on it who are free from any conflict, and who are willing to be independent, be transparent, and to talk to folks, not just folks in the administration. We owe the people who live and work in the prisons better. I am incredibly sad about the fact that I couldn't get the prison advisory board to function or do more. And because I was part of it, I owe everyone, like everyone, an apology, which is not enough. And I hope we can do better, and the city can do better. And I hope people will support a different form of oversight. Thanks.
Thank you. We thank you. You don't owe us an apology, right? Because you were there for the right reasons. It's people like you who we need to have around, who really care about what goes on in there, because it's about human rights. It's about treating people like human beings, regardless of what they are being accused of doing. That's what it boils down to, right? And as you said, there's no mechanism in place right now for authority to do anything or to even look into it. People have no desire. The current board has no desire, right? They're just window dressing. So what needs to be done and what's going to be pushed forward is an oversight board that will allow people, regular citizens, to have eyes in there, to be able to go on the internet and get updates and get reports about what's going on, inside those institutions. We coming down to now. We're going to hear from Miss Perry, Andrea Perry. She was another survivor of that was in the county prisons. Andrea. Andrea's not here. Well, we'll use this. Andrea's not here. So we'll use this time to just have a frank, open discussion, and where I can also give you, ask you, and give you the information that you need about. Excuse me.
Excuse me, John. Is it Adrian?
Yes, Adrian Perry, Miss Perry.
She's not here. Okay.
No, she's not there. Okay. One of the things that we wanted to come out of tonight was not only for people to sign up for organizations. You have a number of organizations on here. I think that some of them did a disservice. They didn't announce their organization strongly enough. So before I leave, I'm going to announce the organizations and sign up. Just put it in the chat. Put your email in the chat, your name, your email in the chat, and which organization you would like to be affiliated with. And we'll make sure that they get that information. And then we'll also have a link in the chat right now where you can sign up. You can sign up for training to go see your city council person, so that you'll know what to say and how, who my city council person is, what are they supposed to do, things like that. So that link is also in there for legislative training. They have two links in the chat. Okay, so now we're going to hear from Reverend Art. Reverend Art Brown. You want to introduce yourself and tell them what organization you represent?
Unmute.
Unmute, Rev. You on mute. Okay, let me.
Oh, can you hear me now?
Yes.
Okay. Yeah, my situation is so I had to move from my computer to my phone, and my phone doesn't work like the computer, so I'm sorry I couldn't unmute myself.
Definitely
I'm going to be
understand.
very quick. I represented the Ending Mass Incarceration team with Power Live Free, and also I represent the Philadelphia Alliance of Black Social Workers, and I'm going to be quick. We were considering the Power Ending Mass Incarceration team. We were considering a moral budget, just whether the moral budget would impact upon the prison conditions way back in early spring, and this is what we wrote. The early mass incarceration team selected prison conditions as a subject to address the concept of a moral budget and its application to the public safety of Philadelphians and the safety of incarcerated citizens. In 2022, 2023, the budget for the Department of Prisons is 200 million plus, and yet the conditions there are deplorable. And I quote from the Prison Society. Since 1787, the Pennsylvania Prison Society has worked to ensure humane prison conditions and jail conditions and advocate for sensible criminal justice policies, unquote. Also, it monitors problems, noting the following conditions as problematic and offering recommendations that will lead to, and I quote, a safer facilities and safer Philadelphia, unquote. Some of these problematic conditions are prisoners locked in cells for extended periods, limited access to phones and other issues communicating to family members, unsafe weekend and night staffing, multiple problems with the commissary, physical plant problems, that is rodents, moles and leaks, access to medical care and counseling, access to laundry and clean clothes, and lack of a response to filed grievances. In making its recommendation based upon the above and other reporting disturbing conditions, the Pennsylvania Prison Society emphasized, and I quote again, the ongoing crisis at the city's correctional facilities is a confluence of too few correctional staff, administration inefficiencies resulted in people staying in jail longer than needed, and serious plant and management problems, unquote. A moral budget is a document that at least rectifies the above problematic conditions, a budget which creates human or humane conditions in the Philadelphia jails. And I just would like to add, and I don't have the authority from the Philadelphia Alliance of Black Social Workers to say what I'm getting ready to say right now. But Philadelphia Alliance of Black Social Workers came about way back in 1968 because we felt that the welfare systems were not serving Black recipients of services properly, and that we were really oppressing Black social workers. And my heart is broken to know that this dear sister Carrie, she has a master's in social work from Bryn Mawr. I have my master's in social work from the University of Pennsylvania. And to know that a fellow social worker, master's degree social worker, is doing what she's doing, it just breaks my heart. And I just wanted to put that out there to let folks know that there's some concern about that. Thank you, brother.
Thank you, Rep. Thank you, Rep. Really appreciate you coming out. So now we have some time. We have some time to answer some questions. But before we answer these questions, I want to reiterate that we have 2 links in the chat. One of them is for an action committee. The action committee will be directly developed for direct actions, for rallies and protests and things like that, and getting things together for a push for some oversight for these county prisons. So if you're interested in coming out, participating, or just want to be notified when something is going on, put your information in. You can go on there and you can get it out the chat and sign up. Your name will go on the action committee. We also have the legislative training committee in there also, where you can also sign up. You can sign up to either one of those. I want to make that perfectly clear. Please, we need everybody in this fight, because believe me when I tell you that they're not just going to say okay, right? Because the Good Old Boys Club has been doing this for so long, right? Abusing people and torturing people inside there. And believe me, I know they really do torture people in there, right? Believe me when I tell you that. The Good Old Boy Clubs is not just going to give in. So it's going to take the effort of citizens like us. So do we have some questions?
Yeah, good evening. I'm Wally Smith from the Philadelphia NAACP. I'm the new prison chair. So I just wanted to let you know that we're going to get 100% behind this effort. Because I'm just appointed. I used to be for 20 years ago. I was the chair from 97 to 2015. So now I'm back involved to work towards fixing that situation, which is horrible on state road and throughout the state system. So I just wanted to let y'all know tonight that you have 100% of the NAACP participation, and whatever we can do, we want to be on board.
Yes, sir. We'll definitely reach out. We'll definitely reach out. Did you sign up? Please sign to the action committee. Take that link out and register, please. Anybody, everybody, for the action committee. That way we'll have information to get back to you with. Do we have any other questions? We have Melissa, and Melissa, I know I've seen your hand up for a while, and I've seen the other hand up. Okay, so let's hear from Melissa.
Hi, John. Thank you, and thank you to Philadelphia Neighborhood Networks for hosting this. I'm really grateful. I just got off the line with President Catherine Hicks from the NAACP, and I just want to reiterate what the gentleman just said. The organization is definitely on board with what you're doing. I also want to say I had the opportunity pre-COVID to tour Muncie with a couple of state legislators, and I found that women are not having access to personal hygiene products. I was really shocked to find that out. I was shocked to find out that there were no real policies in place about women giving birth in prison and how much time they're allowed to be with their newborn, as well as being handcuffed to the bed, during the birth, so on and so forth. So I was really taken back to find out what actually takes place with women and their children while incarcerated. And I'm really happy to be on this call with you guys tonight. Why? Because last week was my first time actually going into the facilities on State Road. And we went from cell to cell and knocked on the doors to give the incarcerated people voter registration forms, as well as registration forms to get their ballots mailed in. And they didn't even know that they could vote pre-trial. Like, they kept saying, we're felons, we can't vote. And we were like, no, you can vote. You're pre-trial for what you're in prison for right now. They had no clue. So apparently they don't have any access to information. And for the young lady that got on and talked about the conditions, yes, they were deplorable. I mean, I've heard it from friends and family members, but to be on State Road and see it myself, it was deplorable. And I did sign up to one of the committees, and I'm very happy to be on board to be a part of our solution. So thank you very much.
Thank you. Sister Aisha?
Hi, my name is Aisha. I just want to thank everybody before me. I was signing up to visit my son, and so I stumbled on this link, and it asked me to fill my name in, and so I'm here and I'm finding out all of this information. I'm a parent to a child that's incarcerated, and I just wanted to share. I heard all the stories, and I understand what's happening in there, and so if anything I could do, I'm more than willing. I just wanted to give my experience from yesterday. I had a situation yesterday. I had to go visit my son, and I had my grandson with me, and he's 13 years old. I had him since he was 3 days old, and I had custody of him since he was 1. And so I go visit my son up CFCF with my grandson so he could see his father. And yesterday they didn't let us in. I went in there and they gave us a visit for 1 o'clock because you still got to sign up online. And so we got there about 12:30, and they told, so the guy with the big white shirt and the white hat on, or whoever he is, he opened the door for us. And then he waited and opened the other door. And I was like, wow, chivalry isn't dead. And he was like, no. And so I walked through the door, and then as he got past the guards, the window, he says, nobody can come in here with a minor until after 3 o'clock. So I heard him when he said it. So I was like, okay, he's 13, he can't come in. I said, well, is it possible you can change the time, our visit time, so we can see him, because we live in Delaware and it took us over an hour to get here. And so I waited about 45 minutes before they came back with an answer. And they said, yes, 3 o'clock. We'll change it to 3 o'clock. So 2:35, we waited, couldn't wait on the ground. We wait outside the car, just wrap it up. I get back in there at 2:35 to sign in, and the 3 guards that was there are there now. And they took my paperwork, we signing in, and one lady comes out and standing there talking. And then, you know, they processing my paper. So she picks up my paper and was like, oh, Lewis. She was like, so I'm not paying her really any attention. I'm just trying to hurry up and get my ID back. And she says, well, this paper isn't notarized. And I said, notarized? I said, we've been coming up here to visit my son for a while. So yesterday made 2 years that he was in the county. He hasn't even went to trial yet. And because of COVID, and he's just sitting. And so we're going to visit him. And yesterday they told me that it wasn't stamped and it wasn't notarized, my adoption papers for him. It clearly has my name, right, our information, you know, yes. I'm full custody, you know, and it's just really sad. It's really sad. Is. And let me say this. The system fails us. It's not for us to. No, you know.
And that's true. Let me say this. The system is designed to frustrate you, right? To make you not want to or reconsider going to see your loved one. That's the way it's designed. That's what they do. Right. That's part of their plan, right?
Right.
We understand that, and these are some of the reasons why we have to have citizens like us to be involved in that process of that county prison, because right, whether or not you have a loved one in there or not is irrelevant, right? Because if you believe in human rights, then you believe in human rights for everybody, not just for certain people, right? And fair treatment. When somebody comes to visit somebody, and if they drove 10 minutes, right, it's still 10 minutes out their time. And as a city employee, you should accommodate them. That's just the way I see it. Right. You should accommodate the taxpayer. Do you have any more questions? Excuse me.
Oh, I just want to say, Miss Aisha, I'm gonna chat you. So I'll just send you a message in the chat.
John, if I may, real quick.
Sure.
So yesterday, Chris and I were ping-ponging about that budget. And I threw it out there that why don't they just lease triple C's and house the women there and stop moving them around? And Chris, you mentioned that the women were housed at triple C's when they were actually building RCF Riverside, which was supposed to be the women's prison. So if they were to lease out triple C's for the women, then the men could actually be spread out on state roads, and that would reduce a lot of the overpacking of the cells. I've been presenting this option ever since they said we were leaving triple C's before we even moved, before we left RCF and went to ASDMI 3. And it keeps falling on deaf ears, but like we all agree, they're not discussing or sharing the numbers and the schematics about how it's actually been spent.
That's true.
Yeah. And absolutely. You know, I mean, we talked about that. We did talk about that yesterday, that, you know, prior to RCF being built, which was built and designed for women. So the fact that we're housing men in a prison that was designed for women.
It can't hold them in.
It makes no sense to me. It can't hold them like that. But you know, prior to RCF being built, was, you know, the women were housed at triple C's for a number of years, you know, because of how bad conditions had gotten at ASD, because of how bad they had gotten at PIC, because, you know, how bad they had gotten to House of Corrections, other places that they had decided to house women before. So they put all of the women at triple C's, This was probably until around, I think, 2012, maybe, when they built RCF. So, you know, so it's been done before. So you're not actually asking, and people that have been advocating for this aren't asking for anything that hasn't already been done before. Just, it just doesn't seem to be, you know, and I know while conditions at CCCs are not great, they are better than ASD, they are better than PIC, they are better than, you know, than DC. They are better than House of Corrections. So, you know, I mean, it would make sense to do that, but
the time, effort, and energy that I and other incarcerated women spent cleaning ASD Mod 3, power washing them. Then we went over to DC cell blocks where they were condemned by LNI, where they were trying to format them to prepare them to house women when they were initially arrested and placed in quarantine. All of that time, effort, energy, and resources could have been applied to CCCs. The women could have been relocated there last year, and then they wouldn't still be shuffling.
Yeah, I know. I understand completely what you're saying, right? But one of the other concerns that we're hearing a lot about, right, is the budget, is the PDP's budget. What are you doing with that money? There's no programming, no supplies, no nothing. This is why we need oversight. There's another reason why we need oversight. I mean,
all executives lose their pay until they justify their budget. That's it. That's all. The fiscal year just started in July. Everybody's check is snatched until they can justify where that money is going, because somebody needs to monitor the monitors of the monitor, and they're not doing it. And they've been allowing it to go on for far too long, and it's going from bad to worse. So what is it going to say for one of the jails to actually explode, for them to actually start looking into the statistics and the schematics and all of those other little key points that keep just getting overlooked because nobody's putting foot to ass? Excuse my French.
And can I add to that, John? So
sure. What we gonna do before you go, Movita gonna go, and then we gonna close out because we, you know, people have things to do. We've been on for hours. So Movita, you go ahead, and then I'll close out.
Okay, and there are still staff complaints about not being paid properly, not being paid at all. So when we talk about the money, let's follow the trail, right? Because if they can't even pay, you can't do anything without your frontline staff. If they're not even being
paid,
not just paid, but just concerned about the people that they got on the front line taking care of the prisoners, then everything gonna fall down. So there's something going on with the money, and we need to follow that trail.
We're with the assistance of everyone signing up for those committees. We're going to get complete oversight. We're going to dig into all that. We're not going to leave any money. And one last time before I go, we have the action committee. Please sign up. Please sign up for the action committee. You can get involved, and if you want to sign up for a particular organization, put it in the chat. Right? I'm going to leave it here for another minute open. We have the legislative training. If you want to do to understand how to go see your city council person and train how to go in there and things like that. Please put it in the chat. All right, everyone. All right. I always end up with peace. Peace, y'all. Thanks. Thank everybody for coming out.
Peace, everybody. Thank you.
Thank you.
Thanks so much, y'all. Good night.
Thank you. Good night, everyone.
Thanks for your leadership,
Good
y'all.
night. Good night. Thank you.
Bye-bye.
Thank you for
Good night.
Enjoy. Informative.
You right there, John. I know you were right there, bro.